Hello everyone, my name is Richard Koch and I'm here today to talk to you about delegation and conflict management. So with conflict management, the ultimate goal is to have a win-win solution for all. You can possibly have that by using some of these conflict resolution strategies. So the first one up there is confrontation. So before the parties go to upper management, it's best to try and solve the issues at hand between themselves. If that doesn't work, you move on to third-party consultation. So in this point, you would bring in a manager, upper management staff to basically mediate between the parties. Sometimes there's extreme cases and where a person needs behavior change, and they have to do some sensitivity training or anger management if they have issues. Those are kind of extreme cases. The one I like is responsibility charting. Basically, just determines tasks for each party. So, for instance, I had an issue with a coworker at the hospital I work at, where for 3 days straight she just basically refused to do her job. Something was obviously off. I did the confrontation to try and figure it out, see what we could do to hash this, make it work. Unfortunately, that didn't work, so I had to bring in the third-party consultation. The manager basically mediated and heard both sides of the story, and then decided that the coworker was having some too many personal problems at home, and it was affecting her work. So she decided she needed some time off to get all their things in order, and then come back to work. And after she came back to work, she was fine. So unfortunately, we all deal with things outside of work, but bringing them to work can really put stress on everyone. And then there's also structure change. So in this, if the two parties are unable to cohabitate, then they will be transferred to another unit or basically separated from working together. Hopefully it doesn't come down to that. And in extreme cases as well, in like a crisis situation, they're soothing one party. So basically it's like a temporary fix for a conflict to de-escalate the situation and bring it back down from a boiling point. So those are some strategies to use. So negotiation and techniques. So negotiation resembles compromise, but it's best to remember that this compromise is between two parties, and there's no rule on winning or losing, and people need to realize that, because some people may say, well, I'm not the winner, I don't want to be the loser, I feel like I win or lose in this situation. So there's some things that you need to do for these is before negotiations, always trying to be prepared. Do your research on both parties, figure out what the issues are at hand, and see if there's any hidden agendas to make note of for the negotiations. So during the negotiations, you need to act like a role model, be assertive and composed, so with good communication, because then they're going to communicate well, and things won't get out of hand. So after negotiations, hopefully all went well, you need to restate what has been basically given to both parties, so there's no confusion, and then say thank you and let them know that you appreciate them being responsible during these negotiations. So delegations, the 5 rights of delegation. So these are always important. So the right tasks. So each team member has a scope of practice that they must perform or that they can perform. So you need to make sure you give the right task to that person. The right person, so make sure that theirs is in their skill level that the task is delegated to. The right circumstance, so basically the nurse needs to assess the situation and make sure that this task can be completed in this circumstance. So right communication, so when, where, why, who, and what needs to be achieved to make sure that there's no miscommunication, and that way that the task can be completed. So and then the right supervision and evaluation. So make sure that the task is complete and correct. See if the person who did it did a proper job, and how they feel about the task that was at hand. So the delegation evaluation. So You want to set deadlines and monitor progress, so that way you can basically see how it's being accomplished by setting maybe regular meetings if you need to, and be a role model and provide guidance. Convey a feeling of confidence and encouragement that always goes very far when you're delegating tasks, because no one likes to be told what to do. But if you show that you get your hands dirty and do things, and also have confidence in everything that you do as well, that always goes much better. I believe lead by example. So you evaluate the performance, so just make sure that the task has been completed. See if there's any positive or negative feedback regarding that task, and then that way for future task delegations you can learn from those. And then also reward accomplishment. When they finish something that you do or that you've been told to do, just let them know that they did a good job and you thank them for it. That goes a long way, and it's really easy to do that. Some delegation errors. So under delegating. So basically you have the false assumption that the person cannot handle the task at hand. So you want the job done right, you do it yourself. This can get managers in sticky situations because they just become overwhelmed with the situations. Over delegating is obviously the overburdening of subordinates. Fine line between under and over delegating, and a good manager can find that happy medium to achieve the tasks without under or over delegating. So and then improper delegating. So that's basically not utilizing the 5 rights of delegation, and that will cause improper delegating. So some delegation error scenarios. So a nurse asking a certified nursing assistant to administer a medication to a patient while a nurse checks on another medication. Obviously, that's not good. The nursing assistant isn't allowed to give medication, so the nurse would be the one who would do that. So can't delegate a task like that. Delegating a nursing student who has no experience to perform a blood sugar test on a patient while the nurse charts at the desk. Always go and make sure that the person doing the task is able to accomplish this task. They know what they're doing. Read back kind of feedback is good too, to make sure that the task is being done by someone who's trained and knows how to do it. And then failure of the nurse to follow up on that blood pressure that had been taken by CNA prior to administering blood pressure medication. So that's another one where you delegated a task that didn't get completed to you, which should fall on you to do that as well. So a healthy work environment. So a healthy work environment is paramount to production and caring for patients and keeping a sense of professionalism. Atmosphere is vital as this impacts the safety of patients, and it allows nurses to complete their job to utmost satisfaction, basically. And then the one I can't stress enough, appropriate staffing. You hear every day that hospitals are understaffed, and that causes a lot of stress on everyone who's involved, nurses, CNAs, managers, everyone. It's a difficult job to staff correctly, but there's been a lot of studies that show that appropriate staffing leads to less likely bad patient outcomes like death and length of stay and things like that. So my current work environment, I work in a hospital that's over 100 years old, so it's very dated. The equipment there hasn't been upgraded in forever, seems like anyways. So hopefully they're going to start making changes on that. But my favorite thing is it's just like a family atmosphere. When I go to work, it's like my other family. The people I work with just make it such a healthy work environment. We all get along, we all work hard together, and I can't stress that enough, that in any workplace that is pretty vital to have people you can count on day in and day out. It really makes your job and life a lot easier, and it makes the patients happier as well. So that's my presentation on conflict management and delegation. Thank you very much for listening. I appreciate it.